Hi, and welcome to Your Autism Game Plan. Welcome back. I hope you've seen my first video in this yeast series about signs and symptoms of yeast or candida. In this video, I'll be discussing testing options, and in the third and final video, I'll be discussing treatment options and ways that you can get started managing your child's yeast if that is an underlying problem for them. After the last video, you may find yourself saying, yes, my child does have a lot of these symptoms or signs of a yeast overgrowth. So what next? Well, that's part of why I created Your Autism Game Plan. This is such an overwhelming world of autism and autism treatments and underlying causes, so I'm here to help. The first thing is I want to let you know with my patients, what I'll often do is give two options. We can either test or we can treat. And very often, if we are unsure if there's a yeast overgrowth issue, I will recommend testing. Now, the tests are sometimes covered by insurance, but sometimes not. The tests can be a little bit of a pain to collect depending on if you're doing blood, urine, or stool. So there are pros and cons to both options. The second option that I give is not to test first, but to do sort of a trial treatment. Now, if we treat for yeast and symptoms go away, well, we know we were on the right track. We know that child had yeast and we have done the right thing by treating the yeast. And in that case, we've saved ourselves the money and the hassle of doing the test first. So some patients and parents prefer to go that direction. So how do you know what tests to do? Well, there are three options. There's blood, there's urine, and there's stool testing. So let's talk about the blood testing first. If you're gonna do a blood test, you're gonna have to do a blood draw, which might not sound great to you. And so keep listening for the other options. With the blood test, what we're testing for are antibodies to yeast or to candida. And so if those are present, presumably yeast is a problem in this person. Now, I will say the blood test is the least sensitive of these tests. So if the test comes back negative, it doesn't mean there's not a problem always. However, if the test does come back positive for yeast, then almost certainly yeast is a problem. And so especially if there are high amounts of yeast, the test will show positive and you will realize, yes, there's a problem with the yeast here. And once treatment is successful, we should see that antibody start to decline. One thing to keep in mind too is that yeast is very tricky and yeast can actually suppress our immune response. It's a way of yeast protecting itself. The yeast does not want to be attacked, and so it figures out a way to suppress the immune system and protect itself from immune attack. What this means is that the antibodies may not show up because the yeast has suppressed the immune system. The next option for testing is urine testing. And what we're testing there are some markers of potential yeast overgrowth. The OAT test, or organic acid test, OAT, is one of my favorite ways to test for markers for yeast. Now, several different companies offer OAT testing. Some of them are Quest, LabCorp, the traditional lab companies, but also places like Genova Diagnostics or Great Plains Laboratories also do OAT testing. My favorite company to use for this is the Great Plains Laboratory, because on their OAT test, they have a very comprehensive list of other markers that they're testing as well to identify some of the other root causes of symptoms of autism. And so I'll be doing a video later on covering more information about the OAT test and why it's helpful and what it tests for and what you can find out from it. But for now, for the purposes of this video, I think it's really useful to test for the markers of yeast. And it's a simple urine collection that can be done at home. You need to freeze the urine sample, but then you can FedEx it right from home. So it's very simple to collect. The urine collection is a very easy way to collect. Now, if your child is not toilet trained or is in a diaper, there is still a way to collect a clean sample of urine. They come with, if you request them, the kits will come with kind of an adapter or a urine collection bag, which basically sticks to the outside of your child's bottom, and then the urine just goes right in that bag for collection. Depending on your insurance, the OAT test might even be covered fully or partially by your insurance. Now, depending on all those factors, typically the cost of the test is between $200 and $310, sometimes up to $400 depending on the practitioner who's ordering it for you. But I always like to give an idea of cost because of course that can be a factor in choosing testing as well. The third option for testing for yeast or candida is stool testing. Now, there are a couple reasons why you would choose stool testing over urine testing, and many of those involve what your child's particular symptoms are. If your child is having symptoms like constipation, diarrhea, anything GI related, digestive system related, then you might want to choose a stool test over a urine test. And again, hopefully you can get hooked up with a knowledgeable provider who can help guide you on this. But until then, I'm here to provide you with some information on that. Now, the stool test can be a little bit messy to collect, of course, depending on your child and their toileting habits, but it can be well worth it because these stool tests can give a lot of information on inflammation in the gut. Like we talked about in the first video, that can be a big factor in causing our kids those symptoms of autism that are so bothersome. So the stool testing could be a good option as well. Pricing on these stool tests can vary significantly. Generally, with the GI map test, I've had patients pay anywhere between about $160, $170, all the way up to about $360 at the top end. So just to give you an idea of what to expect for those stool tests, that's about the price range that you're looking at. Well, I hope this information has been helpful to you and given you confidence in creating your child's autism game plan. I hope that you have already viewed the video on signs and symptoms of yeast. If you haven't, please check it out. And I hope you'll join me next week for a video on starting treatment of yeast overgrowth. As always, I invite you to email me with any suggestions you have on topics you'd like to learn more about. And as always, be gentle with yourself. You're doing a great job.